Tuberculosis in the United States, a public health threat. Tuberculosis poses a major health burden due to its infectious nature, immunological response, chronic progression, and necessary long-term treatment. In the Middle Ages, scrofula, a disease affecting cervical lymph nodes, was first described. In 1679, Francis Sylvius described tubercles, progression to abscess, and empyema in the lungs. In 1735, the Health Board of Lucca, in modern-day Italy, ordered compulsory notification and isolation of consumptives. 18th century Western Europe, there were 900 deaths per 100,000 inhabitants each year. Tuberculosis became known as the robber of youth. In 1780, Pott's disease was defined as the vertebral collapse caused by TB infection. In 1810, disseminated miliary TB was described as a generalized disease throughout the body. In 1820, the presence of pleurisy and pulmonary consolidation were defined as pathognomonic signs of pulmonary TB. In 1855, tuberculosis was for the first time considered a curable disease. People were sent to sanatoriums for fresh air. In 1865, a French surgeon observed increased frequency of TB in soldiers given their close quarters. In 1880, Robert Koch was the first to identify, isolate, and cultivate the tubercle bacillus. A fourth of the world's population is infected with TB. Tuberculosis is the leading infectious disease killer in the world. It is the #1 cause of death for people living with HIV. Currently, more than 500,000 cases of multi-drug resistant TB are reported each year. In America, in 2018, 9,029 cases of tuberculosis were reported. That was a 1.3% decrease from 2017. 69.5% of the cases occurred in non-US born persons. In 2016, there were 528 deaths in the United States attributed to tuberculosis. 5.3% of TB patients were co-infected with HIV in 2018. And of the 6,684 cases of TB with available drug susceptibility testing results in 2017, 1.9% were multi-drug resistant. In this slide, you see a map of the United States with TB case rates. States such as California, Texas, and New York have the highest rates. This slide shows how reported tuberculosis cases since 1993 in the United States have been on the decline. This chart gives the incident rates for all racial and ethnic groups. As you can see, the highest prevalence are in minority groups such as Asians, Latinos, or African Americans. Tuberculosis is a contagious airborne disease. It is spread from person to person through coughing, sneezing, and talking. When the bacteria is inhaled, droplet nuclei reach the alveoli of lungs. From there, The bacteria may go through the blood to other parts of the body, such as the kidney, skin, spine, and brain. One may be infected, but not sick. These people have latent tuberculosis. When the immune system is overwhelmed in an event, someone's status may change to active disease. 5% of infected persons with normal immunity develop TB within 2 years of infection. Here is infection versus disease. In latent TB, bacteria is in the body, but it is inactive, and it cannot be spread to others. People don't feel sick. A TB skin or blood test is indicative of having been infected, but radiographs are normal, sputum smears and cultures are negative, and respiratory isolation is not required. Those with the disease have large amounts of active bacteria. It is transmissible. The TB skin or blood test is indicative of having the disease. Radiographs are abnormal. Sputum smears and cultures are positive, and respiratory isolation is required. For persons recently infected with tuberculosis, risk for developing TB disease come for those in close contact of persons with infectious TB, those who work or reside with people at high risk for TB, such as in hospitals, homeless shelters, or correctional facilities, children less than 5 years old with positive TB tests are at risk for developing tuberculosis, and persons who have immigrated from areas with high rates of TB are also at risk, as are those traveling to countries with high incidence rates. The homeless and injection drug users are groups with high rates of transmission. Disease conditions and drugs such as alcohol, cancer, diabetes mellitus, HIV infection, malnutrition, and organ transplantation weaken the immune system, putting one at risk for developing tuberculosis. In pulmonary tuberculosis, patients have chest pain. They often cough for greater than 3 weeks, expelling sputum or blood. They have symptoms generally including fever, lack of appetite, night sweats, and weakness. If suffering from extrapulmonary tuberculosis, organs in other parts of the body are affected and symptoms are specific to their location. A diagnosis comes after a patient demonstrates signs and symptoms and has a positive physical exam or chest X-ray. A TB skin or blood test is given. If positive, it's indicative of TB infection. An acid-fast bacilli smear with microscopy is taken, but follow-up confirmation through culture or nucleic acid amplification testing is required. Those who have been given the BCG vaccination, typically people born outside of the United States, may get false positive reactions to the TB skin test. These people require a TB blood test for diagnosis. Treatment of latent tuberculosis infection involves 9 months of isoniazid, 4 months of rifampin or 3 months of isoniazid plus rifapentine. Those with pulmonary drug-susceptible tuberculosis require a 6-month regimen. Phase 1 involves 2 months of isoniazid, rifampin, ethambutol, and pyrazinamide, followed by Phase 2, which is 4 months of isoniazid and rifampin. 3.7% of new cases worldwide are multi-drug resistant, 45% of which occur in China, India, and Russia. Drug susceptibility tests are used to guide a clinician in treatment, but increasing resistance is due to changes in regimens and poor adherence. For those resistant to at least rifampin and isoniazid, 2 years of therapy with second-line drugs such as fluoroquinolones are required. These are expensive medications which cause severe adverse effects. The most effective way to stop the spread of TB is by curing it. For all those diagnosed, take medications as prescribed. Cover mouth with tissue when coughing or sneezing, and wash your hands after coughing or sneezing. Do not visit patients with TB unless wearing proper protective wear. The reported TB incidence is lower than it has ever been in the United States. The goal is to eliminate its presence. To do so, efforts to detect and treat tuberculosis must increase.